Stop scrolling for 5 seconds and look at your hand, not a glance. Really look at it, because in the next few minutes, I'm going to show you something most people over 60 have never been told. Your fingernails have been quietly recording what your heart has been doing for years. And if a heart problem is developing right now, there's a good chance it's already written on your nails. You just don't know how to read it yet. I work with older adults on heart health, and one thing keeps happening. Someone comes in after a cardiac event, and once I look closely at their hands, the signs were already there. This isn't mystical. Your nails grow from a tiny structure at the base called the nail matrix, which sits directly on top of some of the smallest blood vessels in your entire body. When your heart or circulation starts struggling, those tiny vessels often show it first, long before you'd notice symptoms anywhere else. Why does this matter more after 60? Because in your 30s and 40s, your heart has enough reserve to hide small problems for years. That cushion shrinks with age, so warning signs tend to surface earlier, and your hands are one of the first places they show up. A quick 15-minute checkup rarely leaves time for a doctor to study your nails closely unless something obvious jumps out. So this information tends to stay buried in medical literature instead of reaching the people who could use it. Let's fix that. Stay with me until the end, because the sixth sign is the one that catches people completely off guard. The first thing to check for is a nail that looks almost entirely pale or milky white, like frosted glass, except for a thin rim of pink or red right at the tip. This specific combination, a pale body, coloured tip, is different from ordinary paleness, and it's been studied in connection with coronary artery disease, heart failure, and diabetes. In some studies, people with this pattern were several times more likely to have coronary artery disease than those without it. That's not a small correlation. It's a meaningful red flag, and like most of these signs, it builds slowly and silently. I once saw a retired teacher in her early 70s who came in mainly because she felt a bit more tired than usual. Nothing dramatic, nothing she thought was worth mentioning. Her nails showed this exact pattern. Further testing found early-stage heart failure that had been developing for close to 2 years with almost no obvious symptoms. Because it was caught, she was able to start treatment early and is doing well today. Next, check whether the nail is split cleanly into 2 zones, pale or white near the cuticle, and a darker reddish brown near the tip, with a clean, sharp line separating the two. This half and half appearance has been linked in research to heart failure and liver disease, and it usually shows up after long periods of circulatory strain. Like the first pattern, it comes down to blood struggling to properly nourish the nail bed. Both of these signs are visible in plain daylight, no tools needed. Take 30 seconds right now and check both hands under a natural light source. The third pattern is a set of fine white lines running horizontally across the nail, parallel to the small pale crescent at the nail's base, called the lunula. The defining detail here. You can see these lines clearly, but if you run a finger over them, you feel nothing. No ridge, no texture. That's what separates them from normal nail ridging that comes with age. He-say lines are associated with low albumin levels in the blood, which reflects the body under sustained stress, nutritionally and circulatory. Research has found this pattern to be a meaningful predictor of heart failure. I remember a patient in his late 60s, still active and feeling generally fine, who mentioned almost as an afterthought that he'd noticed some faint lines on his nails recently. A cardiac evaluation picked up early heart failure. Manageable, but only because someone paid attention to a detail he almost didn't mention. This next one works differently from the others. Instead of building gradually, it appears suddenly in response to a specific physical shock, a heart attack, major surgery, a severe infection. During that event, the nail matrix briefly pauses production, and when it resumes, it leaves behind a visible horizontal groove across the nail. Because nails grow at a fairly predictable rate, the position of that groove can even help estimate roughly when the event occurred. What makes this sign so important is that it can reveal a cardiac event the person never even realized they'd had. Silent heart attacks are far more common in older adults than most people assume. since the classic dramatic symptoms are often simply absent. I recall a patient who came in for an unrelated issue, and I noticed a clear groove running across several of his nails. When I asked about it, he recalled being unusually unwell several months earlier. Something.